Hi everyone. This week we'll talk about attention deficiency hyperactivity disorder, which I will mostly refer as ADHD. I'm here this week with my microphone. I will sing a song, maybe. Just kidding, of course, this won't happen. Let's start with the definition of ADHD. For the definition of ADHD, we are referring to American Psychiatry Association APA, you already know it, Diagnostic and Statistical Manual of Mental Disorders, to determine whether an individual has an ADHD or not. And current DSM recognizes three subtypes of ADHD. First one is predominantly inattentive type. Second one is predominantly hyperactive impulsive type, and the combined type includes both inattention and hyperactivity plus impulsivity. And the criteria for defining these dimensions are such follows. For inattention, we are referring to the criteria that the person is having some trouble paying attention to the details of a specific task, having some difficulty sustaining the attention, and having some problems with organization. What we mean with organization is here is, let's say, picking up your bag, preparing your school bag for tomorrow class, tidying up your room, dressing up neatly, organizing your environment, your equipment, and yourself, okay? And for hyperactivity, we are talking about fidgeting and leaving the seat, especially at school settings at inappropriate times. And we are referring to the movement here. The person is not able to sit still if he or she shows some hyperactivity symptoms. And for impulsivity, we are talking about not waiting one's turn and not taking appropriate turns for him or herself. Actually, their corresponding words in Turkish is, for inattention, dikkat eksikliği. For hyperactivity, hiperaktivite, hareketin yoğun ve yüksek seyrediyor olması. And for impulsivity, we are referring to dürtüsellik in Turkish. And you will see that if you are gonna work at private setting as a psychological counselor or psychologist, sometimes our clients come to us with this impulsivity. This doesn't make them attention deficit hyperactivity disordered person, but sometimes we work with this impulsivity in terms of the mental health, okay? Just a little information. Let's go on with the prevalence. I need to erase these. Okay, when we check the prevalence of ADHD, we see that actually it is one of the widely recognized disorders, okay? And for most of the authorities, the estimate rate for ADHD is from 3% to 7% of the school age population. When we look at Turkey, you see that the range differs from 6.5 to 8.6, actually quite a high frequency. And when we check the nature of ADHD, we see that according to the researchers, there are some gender differences. We see that the research findings posit that most of the ADHD cases are more frequent in boys with respect to the girls, and this is explained by the findings of the research by the fact that boys are identified more often than girls because they tend to exhibit highly noticeable hyperactive or impulsive type of ADHD. But for girls' case, we see that their ADHD profile mostly fits to inattentive type. See, in the culture, especially also in Turkish culture, we see that erkek çocukları daha hareketlidir. Onun doğası bu. Okay, but when this is overdosed and parents tend to take their child for diagnosis more, hence they are maybe identified more in this case when compared to the girls. But we don't have an exact finding about this. How do we identify ADHD people? Actually, remember that in our previous lessons, we were always referring to the role of teachers, especially at schools, in terms of identifying exceptional learners. Okay? But for ADHD cases, it is stated that teachers may not always be accurate in their ratings. Hence, the use of several sources of information is suggested, and these are medical examination, clinical interview, teacher and parent rating skills, and behavioral observations. Why we are not able to rely on only the teacher's rating is that sometimes these hyperactive children are actually mixed with children who have some behavioral disorders. You know, there is a term in Turkish, naughty, yaramaz. But after a point, if a child starts to pressure the teacher in the class, then the teacher may be eager to call the child like, oh, he's hyperactive. Okay, so this is the point why we are trying to not rely on only the teacher's report, but to utilize from several other sources as well. Let's go with these 4 types of assessing ADHD one by one. Okay, for medical examination, we see that actually the professionals seek for brain tumors, treat problems, or seizure disorders, coming to the conclusion that these may be the cause of inattention or hyperactivity. We don't have a clear-cut reason for this, but in medical examination, these are cared for and these are considered. Second way of assessing whether a child, a student has ADHD, we utilize from clinical interviews. And in these clinical interviews, we should interview with the parents and the child at the same time. And as a result of these interviews, you gain information about the child's physical and psychological characteristics and the family's dynamics and the child's interaction with peers, which you will understand the importance of in, I think, 6 or 7 slides later. But of course, here there is the subjective nature of the interview situation. We see that most of the time, child comes to the session, but he or she doesn't show any inattention, any impulsivity, or any hyperactivity. So there is this subjective nature of the interview situation where you may not get the accurate picture. For example, in my sessions, families were taking their child to me, and they were saying that he is hyperactive, he's not able to focus on anything. And actually at those times I was giving the child a task, let's say a puzzle, or to construct something with Legos, or to draw a picture. And while I was talking about the nature of what's going on about the child with the parents, I was taking the time. And most of the time, of course, the attention span is based on the child's developmental level. But for preschool children and first and second grade children, actually 20 to 30 minutes of attention is really good. And I was sharing with the parents the situation that, hey, see, let's say the child's name is Ali. Ali has been playing with these toys for 20 minutes. And they were getting surprised. Okay, we never took time of it, and it's actually a pretty good time. Okay, sometimes you can give such information to parents which will make them relaxed. Okay, and the third one is the rating scales to diagnose ADHD. These rating scales may be filled out by teachers, parents, and sometimes in some cases by the child. But the most popular rating scale is Connors 3 and ADHD rating scale 4. Okay, if you want to specialize in these fields, get the training for these. Okay, and lastly we have these behavioral observations in order to identify ADHD cases. Of course, a clinician's observation is more professional, and these observations can be either done in a classroom or a specially designed observation rooms. We don't have such things in Turkey, but you can see psychological counseling centers or clinics. In a private setting, you can observe the child's behaviors and attention span, hyperactivity and impulsivity. Okay, and let's go with the causes of ADHD, which most of the time all of us wonder. Actually, there's a controversy on what actually causes ADHD. This is actually valid for most of the disorders. We are not able to come up with very strict definition of causes of disorders, but of course we have some research and we have some studies. So as a result of these research, we come up with some solutions. And firstly, let's talk about these neurological abnormalities. Actually, most of the research has shown that, have deposited strong evidence that there is a linkage between neurological abnormalities and ADHD. And the researchers have come up with the idea that inattention and hyperactivity may result from a possible brain damage. But of course, in order to get this information, the development of neuroimaging techniques such as MRI, magnetic resonance imaging, positron emission tomography scans, PET scans, and fMRI studies have allowed most of the researchers to obtain more detailed and reliable measure of brain functioning, and as a result they have come up with the idea that ADHD most likely results from neurological dysfunction rather than actual brain damage. Okay? And when we are talking about neurological dysfunctioning, of course, it's inevitable to talk about the areas of the brain affected. When we are talking about ADHD, we are referring to the abnormalities in 5 areas of the brain of people, which are prefrontal and frontal lobes, basal ganglia, cerebellum, and corpus callosum. Actually, we will briefly cover these. Prefrontal and frontal lobes are located in front of the brain, and they are responsible for executive functions. This is very important. Executive function is the ability to regulate one's own behavior. What does this refer to? For which criteria of ADHD I would need this? Hyperactivity, inattention, or impulsivity? If we were in class face to face, I would ask this question to you, and I would hope to get the answer of impulsivity. Okay? And the second responsible part is basal ganglia, very deep within the brain. And basal ganglia have 2 parts, the caudate and the globus pallidus. And it has been observed that in persons with ADHD, the structure of caudate and globus pallidus are abnormal. And this basal ganglia is responsible for the coordination and control of motor behavior. Then mostly what it would it refer to? Hyperactivity. Okay? And cerebellum is again responsible for the coordination and control of motor behavior, works with basal ganglia together, so they are mostly related with the hyperactivity part. And for corpus callosum, it consists of millions of fibers that connect the left and right hemispheres of the brain, and they are responsible for communication between the hemisphere, and they are important for a variety of cognitive functions, which would mostly be related to inattention. Because when we are talking about cognitive functions, we are referring to memory, generalization abilities, etc. So inattention is one of those related areas with this. And we wouldn't finish this part without mentioning about the neurotransmitters. We see that if there is any abnormality in the neurotransmitters is visible, then these might cause ADHD. I think you already know about neurotransmitters. They are the chemicals that help in the sending of messages between the neurons in the brain, and the researchers have found that abnormal levels of dopamine and norepinephrine results in developing ADHD, just for you to know. And also the researchers say that ADHD may have a hereditary basis. They say that evidence for the genetic transmission of ADHD comes from at least 3 sources: family studies, twin studies, and molecular genetic studies. Okay, now we will check them. So far, what we mentioned is ADHD may be caused by some neurological abnormalities, especially in 5 parts of the brain affected, and also the ADHD may be caused by some abnormalities in norepinephrine and dopamine. And also we said that there are these hereditary factors which have been proven by family, twin and molecular genetic studies. And also we know that there are toxins effect for developing ADHD, and that's all. Let's cover these. Firstly, hereditary factors. Let's see the sources of this finding. Firstly, family studies have indicated that if a child has ADHD, the chance of his or her sibling having ADHD is about 32%. This means that actually these family studies support the idea of hereditary factors in terms of transferring ADHD to the siblings, etc. And also we have some evidence from twin studies, and several researchers have compared the prevalence of ADHD in identical versus fraternal twins. And the studies consistently have shown that if an identical twin and a fraternal twin each have ADHD, the second identical twin is much more likely to have ADHD than is the second fraternal twin. And last evidence comes from molecular genetic studies. With the mapping of the human genome have come advances in molecular genetics. Molecular genetic research on ADHD is early stages, but the research is consistent with the idea that several genes contribute to ADHD, but in this case we don't have very strong proofs. These are suggestions, okay? And also one of the last possible cause of ADHD is toxins. They are defined as agents that cause some malformations in the developing fetus of a pregnant woman. Again, the evidence for this is not very strong, but it has been found that some children with ADHD have higher levels of lead in their blood, suggesting a great exposure than non-ADHD children to this known toxin. Okay, but of course these are supposed to be investigated more. What I have covered so far as the causes of ADHD needs further investigation. Okay, after we mentioned about the definition, prevalence, and ways of identifying ADHD throughout the possible causes of it, let's go through the psychological and behavioral characteristics of ADHD people now. When considering the psychological and behavioral characteristics of ADHD people, we are mostly in the literature following Berkeley's model of ADHD. But in Berkeley's model, he has mostly referred to behavioral inhibition, executive functions, and adaptive behavior. Let's go with the model. Actually, this model proposes that problems in behavioral inhibition set the stage for problems in executive functions and time and awareness and management, which then disrupt the person's ability to engage in persistent, goal-directed behavior. So let's first talk about this behavioral inhibition. Let's see what it is. Actually, it involves the ability to delay a response, to interrupt an ongoing response if one detects that response is inappropriate or to protect a response from distracting. Actually, this is so easy to understand. Culturally, there are some behavior rules, right? Like following someone's talk, not taking turn, not disrupting someone, not distracting the situation, etc. These are for like following behavioral rules. So, when we are talking about behavioral inhibition, actually this involves the ability to be able to follow these behavioral rules, okay? And the second thing, actually, the ADHD people have some problems in this behavioral inhibition. And the other part, they have problem as executive functions. What actually we had defined this. This is the ability to regulate one's own behavior. And executive functions are controlled by the prefrontal and frontal lobes of the brain. And in Barclay's model, if a person has ADHD, they can display some problems with executive functioning in 4 general ways. First is problems with working memory. You already know about it. To keep the information in mind generally refers to working memory. And if you have a deficit in working memory, it can result in forgetfulness, a lack of insight, and forethought, and problems with time management. Secondly, you will suffer from delayed inner speech. This is the inner voice that allows us to talk to ourselves about various solutions when we just stayed in the middle of a problem. And third one is having problems controlling the emotions and their arousal levels. Most of the time we see that people having difficulties with executive functioning are not able to control the arousal and display of their emotions. Okay, and lastly, in terms of executive functioning, they have difficulty analyzing problems and communicating solutions to others. They are less flexible when faced with problem situations. Okay, then so far we have covered 2 dimensions of Barclay's model, and they were behavioral inhibition and executive functioning. This means that ADHD people have difficulty to inhibit their behavior with respect to the rules to follow, and secondly, they have some problems in their executive functioning as stated in the neurological studies, which are related to some abnormalities in prefrontal and frontal lobes of the brain. And the third dimension Barclay mentions is time awareness and management. We see that in ADHD people, they have difficulty arranging and managing their time. Most of the time, they are not even aware of the time itself. And they have some difficulties understanding the time and how to organize their own behavior within that time. And this needs further investigation. And lastly, they have difficulty running a persistent goal-directed behavior. You put a goal for them, you want them to achieve it, but since they are also having some difficulty in terms of managing their times, they are suffering from engaging in those sustained goal-directed activities. And also here there is the important role of poor sustained attention, and it represents an impairment in goal or task directed persistence arising from poor inhibition and self-regulation. So with diminished self-regulation or executive control abilities, students with ADHD find it exceedingly difficult to stay focused on tasks that require effort or concentration, but that are not inherently exciting like many school-related activities. So now we mentioned, again I'm trying to summarize it, we mentioned the definition of ADHD, its prevalence, its possible causes, its way of identification, and for psychological dimensions we mentioned about the Berkeley's model of ADHD. And here it's inevitable to consider the adaptive behavioral skills of ADHD people. When we are talking about adaptive behavioral skills, we are referring to self-help, community use, home use, and so forth. Mostly, these adaptive behavior skills are actually associated with mental retardation or intellectual disorders. But in recent years, authorities in the field of ADHD have discovered that children and adults with ADHD also have some difficulties in adaptive behavior. And also, they have some social behavior problems. We see that most of the students with ADHD are not liked by their peers. So, they have socialization problems, and as a result, they are suffering from social rejection, and this leads to social isolation. Actually, most of the time, these students want to have friends, but since they are overreacting and they are not able to regulate their emotion arousals, and sometimes they are not able to control their urges, they act very fastly and in a way interrupting their peers actually. So although they want to have some friends, they are not able to react accordingly, and this ends up in a vicious circle in which they attempt to win friends, but since they have difficulties in impulse control, they bother their friends and they are not able to get those friendships they want. And lastly, we will talk about medication considerations, and actually on this Thursday we will have a debate on this. Should medication be used on ADHD or not? Actually, this is one of the most controversial topics in all of the special education area in the treatment of ADHD with medication. But maybe it is useful for you to know what is used in the medication for treating ADHD symptoms. Firstly, psychostimulants, which stimulate or activate neurological functioning, are used and prescribed for ADHD. However, promising research is emerging on a number of non-stimulants, and Statera is an example of this, which is prescribed for ADHD as a type of stimulant prescribed for ADHD. Ritalin, Adderall, and Vivance are the stimulants that are most of the time prescribed for the treatment of ADHD. Okay, we came to the end of our presentation. ADHD is a highly prevalent disorder, and you can see this in most of the people around you. But there is this issue that you shouldn't mix people with behavioral disorders to ADHD, or to children with a high energy to hyperactivity. Not every energetic person is hyperactive. And you know that there was this saying among especially the parents, if your child is hyperactive, then he or she is gifted as well. Okay, we had talked about voice exceptionality, but this is not the case all of the time. Hence, please be careful about the definition, and for ADHD diagnosis and identification, whatever the condition is, please refer to different sources of evaluation. Take care, stay healthy, enjoy your days, and see you soon. Bye bye.